Welcome back to the deep dive. So today we're digging into something, well, pretty fundamental. Health equity.
Mm-hmm.
It's easy to think health is all about, like, individual choices, right? Eat your veggies, go for a run.
Right, but that's really only part of the story, isn't it? Often a small part.
Exactly. For so many people, especially in minority communities here in the U.S., there are these huge systemic hurdles that, well, they basically dictate health outcomes.
Yeah.
And often those outcomes are, frankly, devastating.
Yeah, and what's really interesting, and I think really important for, our listeners to grasp, is how certain organizations are tackling this. Like the Institute for the Advancement of Minority Health, IAMH, they call
That's
it.
AMH, right?
Yeah. They're not just collecting data on these disparities, they're actually out there, on the ground. They're implementing these community-based strategies to really confront the issues head-on, specifically in Mississippi.
And they have a pretty ambitious goal driving all this.
Oh, absolutely. Their stated mission, their ultimate goal, is to completely eradicate health disparities and achieve true health equity, which, in their words, means making sure everyone can reach their highest possible standard of health, regardless of background. That's a powerful mission, a really aspirational one. So health equity, in this context, it's about everyone getting a fair shot at being healthy.
Exactly. A fair shot, which, as you said, isn't the reality for a lot of folks right now.
And IAMH, they're relatively new on the scene, started in 2019.
That's right, 2019. But they definitely hit the ground running. They've got this intense focus on the southern region, covering all 82 counties in Mississippi. It's quite the undertaking. Okay, so our mission for you listening today is basically to give you the inside track. We want you to understand this complex landscape of health equity work through the lens of this one organization. We'll cover the challenges, some surprising facts, and some really concrete examples of how IAMH is fighting for better health in these underserved communities. Now, you mentioned IAMH was founded to tackle these disparities head on. That founding mandate itself kind of highlights how urgent the situation is, doesn't it? It can be pretty sobering when you look closely.
It really can.
They were set up specifically to reduce health disparities among disadvantaged and underserved minority populations. So if we zoom into Mississippi, what does that look like? What are the actual specific challenges IAMH is confronting there?
Well, connecting it to the bigger picture, we're not just talking numbers on a page. These are real lives, potential cut short, communities bearing these often preventable burdens. IAMH points to a really stark reality, especially for Black men in Mississippi. They're significantly more likely to die too young from things like heart disease, diabetes, prostate cancer diseases that are often preventable or manageable with good care.
Wow.
And just more broadly, African Americans in the state face higher rates of death and illness across a whole range of conditions.
And it's not just about telling people to eat better or exercise more, is it?
No, not at all. I mean, individual choices matter, of course they do, but IAMH's work recognizes this is deeply rooted in systemic problems.
Like what kind of things?
Things like unequal access to quality health care, for starters, environmental factors where people live matters, socioeconomic disadvantages play a huge role, even historical mistrust of the medical system, which is, completely understandable given past experiences.
Yeah.
So IAMH is right there on the front lines trying to actually reverse these trends, especially around chronic diseases and just getting basic quality health care access for Black men. That paints a really vivid picture. Heartbreaking, really. So, faced with these huge entrenched problems, how does an organization like IAMH even start? How do they begin to chip away at these barriers? What's their strategy on the ground? What does the day-to-day look like?
Well, their approach is impressively comprehensive. They clearly understand there's no single magic fix, no silver bullet for these kinds of systemic issues.
Right.
So IAMH isn't just, say, treating illnesses after they happen. They're working to build a stronger, more sustainable health infrastructure within the community.
How do they do that?
It involves several things: intensive program development and making sure those programs work culturally, that they're based on evidence. They also do a lot of training and technical assistance, basically giving local leaders and community groups the tools and knowledge they need.
So empowering others, too.
Exactly. A really key part is what they call organizational capacity building, which means they help smaller, often under-resourced community groups get better at leadership, operations, and crucially, grant writing. Well, that's smart, helping them get funding.
Yeah, so those local groups can then expand their own health initiatives, It creates this ripple effect. It's this whole portfolio of resources aimed at improving health for the underserved across the entire state.
So it's not just them providing services directly, they're actually strengthening the whole support system.
That's it.
Yeah, that's a really sophisticated strategy. Can we dive into some specific examples? I know you mentioned the Black Men's Health Equity Conference at Tougaloo College. That sounds like a major event.
Oh, absolutely. That conference is really a cornerstone for them. It happens every year at Tougaloo College.
Hmm.
And its purpose is explicit, to directly tackle those really alarming disparities we talked about. The high rates of chronic disease, the barriers to getting health care that Black men face disproportionately.
Hmm.
And what's really insightful, I think, is how broad the topics are. It's not just, here's how to manage diabetes. It covers mental health, chronic disease prevention, sure,
Hmm.
but also things like financial literacy,
Hmm.
environmental justice, even the health impacts of climate change.
Wow, climate change and financial literacy linked to health equity. That really shows they get the bigger picture, the social determinants of health.
Exactly. It's holistic.
And it's more than just talks, right? I heard they have workshops and, importantly, free health screenings.
Yes, very practical.
Yeah.
Workshops and free screenings are a huge part of it.
I even saw a quote from Mississippi Public Service Commissioner DeKeither Stamps. He actually got screened there and encouraged others. He said something like, "I got all my tests done. It's critically important that you know your numbers and how to keep them low."
Yeah, that's powerful. Leading by example like that makes a huge difference.
Definitely.
And another thing that organizers like Mac Epps from the Epps Institute really emphasize is the environment they create. They talk about it being a safe space.
A safe space.
Yeah, a place where men feel comfortable asking those sensitive health questions, learning directly from experts they trust without feeling judged. Mr. Epps actually said, events like these give you information you can't always find online.
That makes sense. That direct person-to-person interaction is probably vital.
Absolutely. Especially for overcoming hesitation around health topics, it promotes that proactive management.
So the conference is this big annual event bringing people together, but IAMH also seems to understand the power of just everyday grassroots connections, right? Which brings us to that Tell 10 challenge. That sounds like a really clever way to use existing social networks.
Oh, the Tell 10 challenge is it's brilliant. So simple, yet potentially so impactful. It's this fantastic grassroots movement. And it's built on this understanding that health messages are often most effective when they come from peers, from people you already trust.
Right, not some outside authority figure.
Exactly. So instead of just broadcasting messages, it calls on Black men to first take charge of their own health, get checked up. And then this is the key part, uplift their brothers. Tell 10 other men in their circle to do the same.
And where does this happen?
It's designed to spread organically in places where men already gather and trust each other. Think barbershops, churches, social clubs.
Ah, the natural meeting spots.
Precisely. The call to action is super direct. Get your checkup. Tell 10 brothers to do the same. Share it and tag them.
So using social media, but rooted in real-world connections.
Exactly. It's about turning that social capital, that trust, into health capital, which is just indispensable if you really want to reach communities that might be missed by traditional outreach.
Yeah.
It directly addresses that tough reality that Black men are at higher risk of dying young from things that could be prevented, because IMH gets it.
Yeah.
Health choices aren't made in a vacuum. They're shaped by your community, by the system. So real change needs that collective push, that peer support. It's about shifting the whole community norm towards health.
That's incredibly insightful. Building health conversations into the places people already are. Genius. Okay, so beyond these big community movements like the conference and Till 10, what about other, maybe more specific prevention efforts? How do they handle particular health issues or screenings?
Well, their targeted work is just as thorough. It shows they understand the diverse needs within the community. For instance, they have specific programs to help African Americans quit smoking. That's huge given the impact of tobacco-related diseases. They push hard for early cancer screenings because we know early detection saves lives dramatically.
Right.
Getting more people tested for HIV is another major focus, plus promoting healthier lifestyles, education about nutrition, physical activity. But underlying all of that is the push to ensure people can actually access quality healthcare when they need it.
Yeah.
That remains a massive barrier for so many.
And it sounds like they offer some very practical hands-on resources too, like those sexual health kits.
Yes, exactly. Through their Know Your Status, Own Your Health campaign, they make it really easy for people to get crucial resources. You can just request free HIV test kits and sexual health kits, and they send them out discreetly.
That removes a lot of barriers right there. Privacy, cost, maybe
Yeah.
just getting to a clinic.
Precisely. It puts the power and the resources directly into people's hands, empowers them to take charge of their sexual health.
And it's clear their vision isn't just limited to men's health or specific diseases. They seem to look at the whole lifespan. You mentioned the Baby Depot earlier, supporting new life from the very start.
That's right. The Baby Depot is another really vital piece of their work. Shows that holistic view again. It specifically gives resources and support to new and expectant moms in central Mississippi and the Mississippi Delta.
And what kind of resources are we talking about?
Really fundamental things. Stuff that impacts maternal health, infant health, diapers, formula, safe car seats. Things that can be a huge financial strain for families who are already struggling.
Absolutely.
And the support is so critical, especially in the Mississippi Delta, which unfortunately has some of the highest rates of infant mortality and maternal health problems in the whole country.
Wow, I didn't realize it was that severe.
It is. So by providing these basics, IAMH helps reduce stress for moms, make sure babies have safe care items, and just supports a healthier beginning for both. It's a direct investment in health equity right from birth.
That makes total sense. A healthy start really sets the foundation for everything else. And it seems like they're just deeply woven into the fabric of the community, even doing things like a back-to-school supply drive with a local church.
Yeah, they teamed up with Word and Worship Church in Jackson for that.
That just feels like real holistic community support, doesn't it?
It really does. And it underlines their understanding that health isn't separate from everything else in life. You know, a kid who has school supplies feels more prepared, less stressed, does better in school. And education level is strongly linked to long-term health and economic status.
Ah, another connection.
Exactly. So partnering with a church, leveraging those existing community hubs, it's all part of addressing those broader social factors that shape health. It's all connected.
Okay, so we've talked about the approach, the programs, but the real question is always impact, right? The proof is in the pudding, as they say. Are they actually moving the needle? Can we see the impact on the ground?
Well, let's look at some recent activities, just from September 2025. They offer some really timely examples. First off, the mayor of Jackson, John Horn, officially declared September 2025 as Prostate Cancer Awareness Month in the city.
That's significant. Official recognition helps a lot.
It really does. And IAMH was central to that. Their own epidemiologist, Warren Jones, was actually a featured speaker at the press conference held at the state capitol. He was there sharing critical information about, knowing your family history and why early screening for prostate cancer is just absolutely essential.
And the stakes are incredibly high there, especially for Black men, as you mentioned earlier.
Unbelievably high. It bears repeating. Prostate cancer is the second leading cause of cancer death for men overall, but Black men are more than twice as likely to die from it compared to white men.
Twice as likely? That's staggering.
It is. And it's a disparity. IAMH is fighting relentlessly. Their message is loud and clear. Men, don't wait. Go get checked. Talk with your doctor about prostate cancer screening today.
So beyond the official proclamation, what else did they do for Awareness Month?
They organized a whole series of community events throughout September 2025. There was a community awareness forum scheduled for the 25th, likely bringing people together with experts for deeper discussion. And interestingly, a prostate cancer Sunday planned for the 28th.
Prostate Cancer Sunday in churches.
Yes, specifically encouraging awareness about PSA testing, that's the prostate-specific antigen test, during Sunday worship services. They even encourage people to wear blue to show support. It's that integration of health messaging into trusted community spaces again.
That's a really comprehensive push, combining medical advice, government recognition, community forums, and faith-based outreach. Very thorough.
Mm-hmm.
And speaking of big events, that Black Men's Health Equity Conference we discussed, it seems like that's really gaining momentum too.
It definitely is. The one in August 2025, back on the 28th, was their third annual conference, again at Tougaloo College, which really shows it's become a sustainable, key event.
And who attends? Is it just health professionals?
No, that's what's key. It brings together a real mix. Community members, faith leaders, healthcare providers, even policymakers.
Ah, getting policymakers involved is crucial for systemic change.
Absolutely. That multi-sector approach fosters the kind of dialogue and collaboration you need to tackle things systemically, not just individually. Warren Jones, the epidemiologist, summed it up well again. He said, "This conference is important to acknowledge the disparities and come up with strategies to help men live healthier lives."
So it's about acknowledging the problem and building the solutions together.
Precisely. It's not just about sharing information. It's about building a collective strategy for action.
Yeah, this really paints a clear picture. IAMH isn't just operating in the community, they seem deeply embedded within it, working hand in hand with different partners, local government. It feels like a truly integrated effort, building health equity from all sides.
That's a great way to put it. Integrated, community-led.
So we've really covered a lot of ground today on the Institute for the Advancement of Minority Health. From their core mission, tackling those deep-seated disparities, to these really innovative and impactful programs, Tell 10, the Health Equity Conference, their work on prostate cancer awareness. It's genuinely impressive to see the tangible steps they're taking in Mississippi.
It really is. And, it brings up a fundamental question, I
Yeah.
think, for all of us. When we talk about health in general,
Hmm.
are we truly talking about everyone's health?
Mm.
IMH's work is a powerful reminder that getting to real health equity, it's not like flipping a switch. It's a continuous journey. It takes that sustained community effort, focused education, and just relentless advocacy. And what's so clear from their model is that knowledge itself isn't enough. It's most powerful when people understand it and, crucially, can apply it. And IMH is really providing the tools and the platforms for exactly that.
Absolutely. A really vital point. Knowledge into action. So as you listening, think about everything we've discussed today. Consider that power of community spaces. The barbershops, the churches, the places IMH taps into so effectively. Maybe ask yourself, where in your own community could these kinds of health conversations naturally start? Where could they take root and really make a difference in people's lives? Something to think about. Thank you so much for joining us for this deep dive into health equity and the work of IAMH. We hope it's given you some valuable insights and maybe a new way to look at health in your own world.